Wonderful. Welcome, everyone. Good evening. This is AFRIGE, and AFRIGE stands for Africans for Restoration of Ethics in Government. Tonight, we have a very special program. We're talking with one of our community partners, and we're going to be addressing a wonderful topic. Guess what it is? Addressing health risk of women of African heritage. This is so critical and so timely. And I'm just delighted that we can address it, especially in light of a special event that is coming up on Saturday. But you will hear more about that. But right now, I want to introduce you. I am Visha Ricks, your host. This AfriAge is the vision of Dr. Aquilas Ricks, who is the founder of AfriGe, and he's a native of Liberia, and he's passionate about bringing actionable solutions for the continent of Africa. But tonight we have the esteemed honor and privilege to actually be speaking to someone that is a practitioner and a community partner for over 50 years. Please welcome our dear friend, Dr. Gaylynn Richards of the Breast Cancer Education Association. Welcome, Dr. Gay.
Oh, Lady V, thank you so much for inviting me. And I am, Dr. Gaylynn Richards, but I don't know who that Dr. Richards is. So please call me Dr. Gay because out in the community, that is what the ladies call me. And that's what I like.
Wonderful. Well, Dr. Gay, it has been a pleasure. And I just want to alert you, all of our listeners, friends, family that are watching on Facebook, we thank you for joining us tonight. I have had the honor and the privilege of serving with Dr. Gay as well as with Ethel Livingston. Every year, they sponsor not only one, but multiple health fairs where they are encouraging women, signing them up for free mammograms, for free blood pressure checks, for free tests for HIV. She's passionate about health and ensuring that we have a better quality of life
Yep.
by looking into our health issues. So I've been with her on the front lines, just at a couple of events, but she does this all year long. So we are delighted and privileged to have her with us. Dr. Gay, please tell us a little bit about yourself and your organization.
Thank you so much. Well, as you've already heard, I am an advanced practice nurse. I was telling Lady V before we came on live that I got my first nursing license in 1972. So if you know your math, you know I have been a nurse for over 50 years. And I have spent most of that time in the cancer space. And I'm going to tell you why. My family was swept away by breast cancer. Now, all of us have a favorite auntie, right? We have a favorite auntie. My favorite aunt, my Aunt June, she was a large woman. She could fill a room with her effervescence, her spirit, her joie de vivre. She was diagnosed at 35 and gone by 40. I was
Wow.
about 20 years old, and right then I knew that this was the path I was going to be on. A few years later, my mother was taken,
Oh,
my
wow.
grandmother, my cousins, and then my other aunt later in life. So I have made this is what motivates me. I don't want other families to experience what my family experienced when the women of my family were all swept away within just a few years. And it's true what they say. There are a number of health issues that impact on us as women, and particularly some that have a bigger impact for women of African heritage. Most of my career, again, is in the cancer space, but I prepped a little bit by looking at some other things that affect women of African heritage. And like any other population. It's things like high blood pressure, diabetes, things that we really need to think about lifestyles. So I could answer questions about that, but I really, as always, want to focus on what I think is very important work, and that's taking care of ourselves and making sure that we are having a good quality of life by engaging in regular screening, particularly for me because of my passion around mammography. Now, I don't do the work alone. I have a team of dedicated women, including Mother Livingstone. They are the breast cancer champions, and we work in all the communities of African heritage, but we'll actually go where we're invited. So we'll work with Spanish speaking women, we'll work with the native women, we'll work with anyone who invites us. And we are a team of dedicated women who bring tailored education. We'll navigate you to screening. We'll have some fun while we do it. Let's get some mammograms done. Let's get some other work done. Let's bring in some free services. Let's let's do it, and we'll do it together as women. As women.
I
That's
love it.
me.
I love it. Yes. Thank you, Dr. Gay, for that wonderful introduction and the details about the genesis of your passion. And I can certainly see your passion every time we have a healthy health fair. And this is just incredible that it really hit home. And before I dive into our pre selected questions, I would like to know, now that we know what we know now, I mean, this has been 40 plus years or more since you encountered the death of your Aunt June and then subsequently your mother. Is there anything that you have learned now that, wow, if you or your ancestors had known it, could have changed the course? I'm just curious.
You know, it was such early days in the 70s. Mammography began to be used when the president's wife was diagnosed. Was that, oh gosh, I should have looked this up. And then the vice president was Rockefeller, and then his wife got screened, Happy Rockefeller, and she also had breast cancer. And, you know, that was like in the early 70s, mammography was not widely available, nor was the concepts about follow up. We think with my aunt, she cleaned house for a living. That is a respectable career as far as I'm concerned, but we don't know if she had insurance. So she never had follow up. And that wasn't known until after she died. For my mother, she didn't know going into surgery whether she'd come out with a breast or not. There was no such concept as informed decision making. That just isn't the way things are now. So, over my career, I've seen good advancement in how we understand breast cancer, how we help in the decision making that a woman has to make, and she does have to make a lot of decisions in a really short time. But she can make the decisions, she can be the one making those decisions. But still, we have work to do. And one thing that came up many years later is my brother got into genealogy. And we brought a risk from our way back background, way back many generations, was an Ashkenazi Jewish woman who was married by someone on my maternal side. And that was not known. And that is a risk, just as I've done research on breast cancer in Africa.
Wow,
And
amazing.
there is a risk that women of African heritage have genetically, and they bring it or brought it when they came to this country. And when you
Wow.
add on top of that, yeah, it's fascinating. It's just exactly what we see in women of African heritage who live here in the US. Younger age of diagnosis, higher percentage of women with triple negative breast cancer, which is more aggressive, harder to treat. It's not amenable to some of our standard treatments. And that risk is there from their home of their country of origin. So,
Wow.
very interesting. And we know a lot more about the genetics of breast cancer, not only for women, but also the genetic mutation of BRCA can also lead to men having breast cancer. Men do get breast cancer, but at a much lower rate. But also things like prostate cancer in men and pancreatic cancer in men and women. These things we know now that we did not know then.
Wow. Wow. Amazing. We have come a long way, but we know that there's still a lot more to be done. And I think education and awareness is certainly one of the places to begin. What information you want to share with us regarding the health risk of women of African heritage? You talked a little bit about they bring the genetics. Help us understand, what are you referencing, and how can they either tap into the genetics? Do they need to do a genealogy of their family, or do they need to get tested for the trait? Could you just walk us
You
through
bet.
this?
Yes.
Because we've got some of our constituents, some of our family members,
Yes.
they're on, and this is a key issue. So if you could please share the information that is so needful.
First, know your family history to the extent that you are able. And in our family, we did not know our background going back, like it was probably about 5 generations, 6 generations back. We did not know it. And that may have made a difference for my aunt and my mother, my grandmother, my cousin. Maybe not, because those were very early days. So know your own family history to the extent possible, but understand you may not be able to go back, like Dr. Ora Hoke says, 1,000 years. So know what you can know. Know what you can know. Also, depending on family history, you may decide that you are interested in learning more about your genetics and not a me 23andMe. Genetic testing these days is, insurance may cover it, but it's actually a reasonable amount. I have a very good colleague who's a genetic counselor, and she's helped me to really understand that we can learn a lot about ourselves by having testing and then make a plan of care. And that plan of care needs to include, it may include some lifestyle choices about all the things we know about general cancer prevention and prevention of heart disease, physical activity, a diet that leans more towards fruits and vegetables and away from red meat, and being, moderate, no smoking. Give up smoking. If you've tried and you're having trouble with it, try again. Just try again. If you do drink alcohol, please be moderate. They have linked even moderate amounts of alcohol to a higher risk of breast cancer, and I just don't think it's worth it. I'll drink sweet tea once in a while, though, sweet, but not with, you know. So
With no
family,
spirits in there, no imbibed.
so know your family history. Think about, is there something in your family history that thinks, maybe I should talk to a genetic counselor? Then the other thing I really want to encourage you today is everyone needs a regular source of care, a regular source of care, a clinic that you go to that is your clinic home. And for many people, they don't understand, if they don't have sufficient coverage, that particularly, I know the most about Minnesota, of course, we have a great system of federally qualified health centers. And they will work with you to find coverage. They offer excellent care at reasonable price, Or like in Hennepin County, Hennepin Healthcare has their own insurance plan, and it's quite good. I worked for the SAGE program, which offers free breast and cervical screening, so I got quite familiar with the health systems. So have a regular provider of care, because not only will they see to what screening you need and at what age, because it varies from male to female and by age, but also the other kinds of things, having your blood pressure checked, having your glucose, your blood sugar checked routinely. We get older, they also want to check things like cholesterol and lipids, make sure there's no heart disease lurking. So, this is about kind of a plan of care for yourself that includes your screening. And screening guidelines are in pretty good shape. For mammography, if you don't have any family history or particular risk or concerns, start at 40. Start at 40. Don't go, every 1 to 2 years. We endorse yearly because we know that a mammogram these days can find a change in the breast that's the size of a grain of sand. Those women, if it is breast cancer, they will be cured. And in Minnesota, we do a pretty good job. We have pretty good screening rates. Not all of our new residents, our new African immigrant residents, their screening lags behind, but we're working on it. We're working on it. And Lady V has seen us working on that. But
Indeed,
think
indeed.
about that regular screening. And then when you get a little bit older, then you start your colon screening. And I think people don't know there's three options to our take home. One's the full colonoscopy, depending on risk and family history. Again, you talk with your provider. Or, like somebody like me, I still take calls, I still consult with people. But to get screened, Lady V, I always said I'm going to dance at my granddaughter's wedding, and she's not married yet. So I, I got to work on it.
Okay, and it sounds
So,
like these yearly screenings would help you to be here for that because if there is something there, like you said, even the size of a grain of
yeah,
sand, wow, that would give hope that you can be cured because that's the early stage versus
absolutely.
stage 3 or stage 4 cancer.
Absolutely. And that's when we look at what happens with data, and I've got some data next to me, but I think it's more interesting just to discuss, is black women and white women get mammography at about the same rate, but black women have the highest death rate of any group. And that's not one reason. It's all these reasons that come together. Part of that is what I talked about, that genetic inherent risk that is part of the makeup of a woman of African heritage, from her African heritage. Part of it is they a woman may not understand how important it is to screen, or she may not have time, or she doesn't know where to go, or she doesn't have coverage. And that's, the great thing here about the SAGE program. That's a free breast and cervical program. Works with over 400 clinics to enroll women and get pap smears and breast exams and be referred for mammograms. And it's kind of like easy to do that.
Wow, once they have the knowledge that this is available, this is a free resource, then they can avail themselves and take advantage of it. I want to tap into something that you talked about, the risk. Has the root cause of these risks been determined? If so, what are some of them? If you can just share, because
What,
knowledge
yeah,
is power.
what a great question. But when you ask the root causes, there's theories, but it's still, see, it's not one thing. It's because I've heard people who don't know any better say, well, somebody doesn't get screened. Well, that's not the whole story. The story is there's a higher risk profile for a woman of African heritage. In Africa and here in the United States, they may be diagnosed with breast cancer at an earlier age. So it wouldn't even be expected. Like, oh, you're not at risk, you're too young. Well, that doesn't really fly. Even young women can get breast cancer. They may not be aware. And the Breast Cancer Gaps Project and the African American Breast Cancer Alliance both have campaigns going on right now looking to young black women to make them more aware. Because a young woman may think, oh, I'm not at risk. I'm not at risk. I don't have any family history. Well, 85% of the women diagnosed with breast cancer have no known family history. We're women. We're getting older. We have risk. So, for a woman of African heritage, what's important, I think, is the kind of work that the champions and I have been doing. We're in the community, like Ethel Livingstone. She's a resource. She's known. She's trusted. We bring tailored information forward to women, and we're there to actually help them understand where a resource is, whether it's SAGE, a free resource, or back to their own clinic. We can help them really every step along the way. And that is what sometimes is needed. I think research will continue to go on. The type of breast cancer that has a higher percentage or impacts a higher percentage of women of African heritage is triple negative breast cancer. One of our speakers at the Saturday Expo is going to talk about that.
Yeah,
And
I've never heard of the triple negative.
triple
Help us
negative,
understand what's the difference between
I
just
will,
breast cancer. Oh, okay.
I will. Most breast cancers are estrogen loving. The cells in the breast, we naturally produce estrogen and progesterone during our menstrual cycles. And breast cancers, most of them, they love estrogen and it's like food and it helps and it makes them grow more. There's so a triple negative, there's estrogen negative, progesterone negative, and then the other one is HER2 new, which is a how can I describe this? It's something that's overexpressed in a particular subcategory of breast cancer. And there's very good treatment for it. Herceptin is the chemo. But for a woman who's triple negative, the standard breast cancer treatments don't work very well because their breast cancer is different. Now there's these new things coming out, like I talked to you about vaccines.
And the
We're really seeing a lot with vaccines and also immunotherapy where you turn your own body's immune system on. This is so promising and so exciting. I can't tell you. And on Saturday at the expo, we're going to hear about a different kind of new research, but we're going to hear about triple negative breast cancer, new therapies, new outcomes from one of the Masonic oncologists. I'm
oh
so
wow.
excited. I'm so
This sounds
excited.
so wonderful. Wow. We're talking tonight to Dr. Gay. She's an expert, a nurse, a senior practitioner who's been in this field specializing in breast cancer over 50 years. We're delighted that she's with us tonight talking about the impact on women of African heritage. We do have a couple of your colleagues that are watching as well. Mother Ethel Livingstone, who is a breast cancer champion, and she's a dear member of our church community. So we are delighted about Mother Ethel, and she's the one that champions this event at our church. And she is definitely beyond the age of 50 as well, but she's so
Mhm.
passionate and energetic about it. And we also have your dear colleague, Dr. Aura Hoke. She says, can't wait to enjoy this health education session with Dr. Gay and First Lady V. So welcome. And we also have Wow, a champion in the Liberian community joining us, Kamon Joe Coley. He says, amazing show. This is very informative show on women's breast cancer. Thanks for acknowledgement of the great work Miss Ethel Livingston is doing in the community. So thank you all for tuning in and sharing your thoughts. Dr. Gay, if you can answer, how can women of African heritage address these risks to improve their quality of life here in America or on the continent of Africa?
I first, again, I think to understand the benefit of what we put into our own personal plan of care around our health. And part of it has to do with things we won't talk about tonight, like managing stress and so on and so forth. But have a regular source of care. And if someone needs some help connecting to a clinic, Ethel or I would be happy to help with that. Park Nicollet has a wonderful matching service for a community member to be hooked to a provider, or we can help connect people to one of our wonderful clinics that we have worked with for a number of times as partners. Also, understand the screening guidelines for your gender and your age. There are not only a free breast and cervical program through SAGE, there are two free colonoscopy programs right now here in Minnesota for uninsured people. One is through mHealth and one is through Minnesota Digestive, the old Minji. And I have those names of actual individuals who will take your calls. And Lady V, I can get those to you afterwards. I want people to know that there are resources, even if you don't currently have coverage or maybe inadequate insurance coverage. But again, that regular source of care. And also, I think, like the family history, understanding prevention. And general cancer prevention is also prevention for diabetes and heart disease. So it's like a triple benefit to get some physical exercise. Now it's gardening season for me, pulling weeds, shoveling. Yeah, I love it. From April to November, really good physical activity. Think about what you eat. Lean towards fruits and vegetables. And I know Ethel and I will be doing the Brooklyn Center Farmers Market. That's once a week on Thursday afternoons at 7200 Brooklyn Boulevard. We'll be out there next week, being a community resource. And, freshly grown vegetables couldn't be better. Again, if you do smoke, it happens. If you've tried to quit, it hasn't worked, try again. Try again. It may take several times. Please be careful about alcohol intake because it has been shown a risk to a number of different cancers, not just breast, but a number of them. So that's kind of like that, reducing that risk by understanding when you should get screened. And if you need help with that, just reach out. Let us help you. The
Wonderful,
champions are a great
wonderful.
team. Yeah, we'll help.
Great, great. This is great, these resources. And I think if you, I'm glad that you offered to share these resources with me afterward because Mr. Kamon Kali, he is over a particular group within the Liberian community. We can disseminate these resources to our community partners, the churches, these community organizations like the one that Camus has, as well as our organization for the different African associations. If we can disseminate this information to them, then they can have knowledge and hopefully they can avail themselves. You've talked a little bit about what's happening on Saturday. Could you please share with
Yes.
us if there's a flyer or something, if you've got it, Ethel, if you could be kind enough, Mother Ethel, and put it in the chat, that would be great because there are other people that may look at this tonight or look at it later and it could be a resource. Tell us what's happening on Saturday,
Okay.
where is it, and what
All
time, and
right.
what do they need to do?
And I actually, hold on, I've got the folder right here with the address too. On Saturday, the African American Breast Cancer Alliance, the Breast Cancer Education Association, and Masonic Cancer Center are collaborating on the Color of Cancer Health and Wellness Expo. It is at the Cancer and Cardiovascular Research Building, 22316 Street Southeast. That's on the university campus. It's on the north side. It's kind of easy to get to. The event will be the Expos from 11 to 4, but we have on-site mammography from 9 to 4.
Oh, I lost her.
Did you lose me?
Yes, I did for a minute. So if you could repeat that it's going to be on the
Yeah.
campus and what you were saying. Great. Welcome back.
Okay. Technology, it's kind of the devil.
Hmm.
So the expo will be at the Cancer and Cardiovascular Research Building, 22316 Street Southeast, Minneapolis. That's on the north side of the campus. And we have free parking. Event is from 11 to 4. We have mammogram from 9 to 4. We have, there'll be free parking, lunch. We have a great lineup of speakers. Wonderful speakers. And we also have Zumba and chair massage and other fun things going on too. We even have two Masonic physicians doing risk assessment and education around colorectal cancer risk and lung cancer risk for screening. We've got about 20 partners tabling with us, so there'll be lots of community resources. And we have a survivor village for the women who have been on or on that breast cancer journey to receive special pampering. There'll be some special activities going on in the survivor village. It just could not be a better day. Not be a better day. So, it's free to attend. And I think it's the beginning of it's just a wonderful collaboration. So Sage will be on site working with the ladies getting mammography. So if someone doesn't have coverage, they'll be enrolled in Sage. Ethel, can I give it away? You and I are both getting mammograms on Saturday.
Woohoo!
Well, you talk the talk, you got to
Great.
walk the
Glad to
walk.
hear that. That's wonderful. Wonderful. The proof is in the pudding. So you're doing it. I love it.
Oh,
It
yeah. And
says
I can,
people love to follow a good example, and you're doing that, Dr. Gay.
well, I just think the speaker lineup, and to have doctors say, sure, I'll give up my Saturday and come over and work with people attending and do education and, risk assessment for them and kind of talk to them about what kind of screening they need. I mean, people have just come forward and been to be part of this. So this may really be something that will become another one of these annual events. And we are so pleased and so thrilled that Masonic just stepped up and said, how can we help? How can we help make this good? So,
Wow, wonderful. I think that is a credit to you, Dr. Gay, that you have synergized and really built these relationships with these various organizations, and they see your passion. And I think they're coming alongside and feeling, what shall I say, a need to do their part to de escalate the rise of cancer, especially within the minority community. And I think that's to your credit. And we pray that this will continue. Let us move forward with
Okay.
another topic. Um, Afrige is the vision of Dr. Aquiles Ricks, who is a native of Liberia. And he is passionate about his country, but also passionate about the continent of Africa. And that's why he created this forum, Afrige, Africans for Restoration of Ethics in Government. And basically, what we do, Dr. Gay, is partner with Africans either on the continent or those in the diaspora who have expertise. But then we also have partners like you. We also have other benefactors that have an interest in seeing Africa be prosperous. And we bring them on to share their expertise and how it can benefit the continent of Africa. And then our goal is to circulate these videos that we have so that those natives of Africa can actually see it. Those that are in leadership who can avail themselves, use the monies, or create these community events that can help the people. If they have the knowledge, then they can do it. So I have to ask you, since at Afrige we try to help Africa do better by doing right, what advice will you give to the government in Africa in terms of helping to address the risk faced by the women of African heritage? What would you share with those representatives, those presidents that might not be listening now, but they could listen later?
In some ways, I think this is such a simple concept. If you have healthy members of your country, healthy communities, you will prosper. Your economic profile will prosper. If you're addressing illness and disease and you don't have resources or support, it will impact on your economic prosperity as a country, on the morale of those who live in the country. There may be unrest. So, health is wealth, health is gold. And I'll tell you, because I've done a little research and I've done a little bit more in the Western Africa states about programs that are arising around breast health and breast cancer and breast awareness. Because Mother Livingstone and I, we're planning with the champions, we're planning Liberia. Might be a year or two
Woohoo!
out, but we're going. But there is an organization out of Washington, D.C. that's working in Nigeria. There is an in country organization in Senegal. I've connected with these people already because even if it could be just the topic that we're passionate about and just along that West African crescent, isn't that at least a place to start?
Yes, I agree. I agree. That's wonderful. That is wonderful. This is great. You've given us such rich information. Those that are watching or those that will be tuning in to watch us, the recording of this, I just want to alert you that what we're doing here is worthwhile, it's informative, and it's for our community. If you believe in what AFRIGE stands for, what we're doing, you can be a part. Obviously, we welcome you to be one of our experts that we can feature. But also, if you want to give in kind, you can do that. We've got our Cash App online as well as our Zelle. These help us to maintain what we're doing in terms of being able to stream this live, being able to disseminate it and communicate to those in leadership within the countries that we know. It takes money and time. So if you want to participate, the information is right there on your screen. We thank you in advance for your generosity. Again, we're addressing our topic tonight on the health in risk for of women of African heritage. So I'm curious, what would you've given us several things, and I've been taking copious notes. I have a whole page of notes here. You encourage us. I love what you said. Health is wealth. And this is something that it's doable. It's something within our sphere. It's not something that we're waiting for. We can do it. You said physical activity, walk more, get to moving. You said eat lean fruits and vegetables. This is something we can make a choice to say no to the chips and say yes to vegetables, yes to fruit. And then you said a plan of care. If you don't have health care because maybe you're not working or you're working part time, there are options. She's
Yes.
provided Sage, she's provided M Health, Minnesota Digestive. There are options out there. I encourage you, come on Saturday, even if it's just to get information and leave. But there are resources out there. But she also said, no alcohol. That increases your risk for all the various cancers that are out there. And then get these mammograms. If you can come on Saturday, there's a free mammogram, free health screening, all, and then some other freebies that will pamper you and help you to feel beautiful about who you are. Please, I adjure you, take advantage, take these small steps for your own health. No one else can do it for you. Dr. Gay, she can only give you the information, but she can't do it. Mother Ethel Livingstone, even though she's so passionate and helpful, she can't do it for you. Only you can do it. Dr. Gay, as we come to a close, what do you want to share? What are the parting words of wisdom that you can give to those that are listening or will be listening to the recording?
First, I want to say thank you for this opportunity. I have, I've actually enjoyed myself, and I'm so glad you let me just be who I am. I think when we think about our health, I see that we play so many roles. We take care of so much. Our families, our husbands, our work, our lives, our church communities. And we have to take care of ourselves too. And we have to advocate for ourselves and be okay with empowering ourselves. And by seeking health in a way that benefits you through screening, through lifestyle choices, and chips are still okay once in a while, okay? Let's make that.
Thank you. Okay.
Just not every day.
Okay. Okay. Wonderful.
What
Wonderful. Mhm.
what we end up with is a community of beautiful, strong women. And we are the strong ones. We are the resilient ones. We are the ones who walk through the storm and come out on the other side. So we must take care of ourselves. And as I said before we began, I want to dance at my granddaughter's wedding, and she's not married yet. So I got to stay healthy and I have to stay around. I don't want families to go through what my family went through when we lost almost the whole maternal line within just a few years. It was really, I don't want that for another family. So if there's something I can do to help that family or that woman, I'm happy to step up. Happy to. So I'll
Wow.
see everybody on Saturday. I have information on those free programs. We have some spots still left open on that mammogram van. There's free A1Cs, there's blood pressure screening, there's memory screening. Come on down. And free parking.
And it's a free event. You do not have to
Yes.
pay, but you're going to get
Yes.
lots of good information and you're going to get
Yes.
free resources. So, why not come down? I will be there. By God's grace, I will be there. Thank you, Dr. Gay. You are practicing what you're preaching. And more than anything, You are lending a helping hand. And guess what? It's being done by women. We are stronger together. We are better together. They are putting it in action. Mother Ethel Livingstone, Dr. Gay, and as well as Dr. Ora Hoax. There's a host of many, many others. If you just come out and see, they're ready to partner with you, and they're ready to walk the journey with you. We heard testimonies at our last two events that we've had about the health fair where Sage was a resource. They paid for the person to get the testing, to come back and get what they needed, even gave them monies so that they can be sustained because they were out of work. It works. How do I know? Because I've heard the testimonies of women in the community that have taken advantage of this. This is such a wonderful resource that you're doing. I know that it's from your heart in honor of Aunt June. So thank you. Thank you. Our hats off to you. You get the gold
Thank
star,
you.
Dr. Gay. And I just pray that God will reward you for the efforts that you're taking on behalf of womankind as well as mankind. God bless you. Thank you so much for joining tonight. This has been Rich. We're going to have the recording. So if you would like to circulate it on whatever social media avenues that you have, you'll be
Yep.
welcome to do that. We did see that we had, I just want to give you the last comments. It looks like we had some new people to join us. Carla Olson joined us. We've got some new comments. She says, Asante Sana. That's from Dr. Hoax. I don't know what that means, but I think you might. And Ethel Livingstone says, this is great knowledge and information. So, again, we are here and we exist to enhance the knowledge of our people. So, thank you for joining us tonight. We really appreciate it, Dr. Gay. Thank you, thank you, thank you. Enjoy the rest of your evening. God bless you. All right. Well, our hats off to our guest, Dr. Gaylynn Richards from Breast Cancer Education Association. Afreeze will be back here with a wonderful guest next week. Guess who it's going to be? It's going to be someone from the Bong County, and he was on the line tonight. Camus Colley. He will be joining us. So join us as he'll be talking with Dr. Aquilis Ricks next week. Same time, 7 to 7:45. God bless you. Have a good night, everyone. Bye bye.
Bye bye.